Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Endometrial carcinoma. Endometrial carcinoma is a hyperplastic condition. Risk factors are excessive estrogen, increased ovulation, family history, hypertension, obesity, late menopause, early menarche, diabetes mellitus. All these are the risk factors of endometrial carcinoma. Atypical endometrial hyperplasia, conditions like unopposed estrogen, like polycystic ovarian syndrome, estrogen secreting tumors of ovary, like granulosa cell tumor, nulliparity, tamoxifen therapy, hormone replacement therapy, when only the estrogen is given in intact uterus. All these, so whenever in hormone replacement therapy, when only estrogen is given, then it leads to endometrial cancer. So the risk factors of endometrial cancer, everything is related to estrogen. Excessive estrogen and increased ovulation predispose to endometrial carcinoma. If there is family history of endometrial carcinoma, then hypertension, obesity, diabetes mellitus are predisposes endometrial carcinoma. If the patient has late menopause and early menarche, obviously there will be increased estrogen exposure in the life, thus resulting in endometrial carcinoma. Atypical endometrial hyperplasia causes endometrial carcinoma. Unopposed estrogen, conditions like polycystic ovarian disease, estrogen secreting tumors of the ovary like granulosa cell tumor, they predispose to endometrial carcinoma due to increased estrogen. Whereas if there is nulliparity, obviously there is increased estrogen exposure in nulliparity, leading to endometrial carcinoma. In tamoxifen therapy, there is increased risk leading to endometrial carcinoma. Hormone replacement therapy. In hormone replacement therapy, when estrogen is given to an intact uterus, then because estrogen is given to an intact uterus, it results in endometrial carcinoma. Estrogen with progesterone, when given together, it will result in hormone replacement therapy, and it causes breast cancer. There is something called as corpus cancer syndrome. In corpus cancer syndrome, if the patient has obesity and hypertension and diabetes, then there will be increased chances of endometrial carcinoma.
thank you and thank you for watching.